I think we're all here because we care about every single individual child that's coming in that door.
I think that's really important for families to know. This isn't a place where people come to work. They choose to work because they're dedicated to our mission and the services that we provide.
This place feels like we are here for these children and we care about them and love them and want to support them.
You get the services of UCSF, but you feel like you're coming home almost.
It's all about the relationship that the providers build and that they know that coming here, this is where they want to have their surgery.
Every day there's something that just you find that you get a smile on your face because you ran into a patient in the waiting room.
We're here because we care about this community and we care about these kids, and we want to do the very best for them that we can.
We're here in Oakland where I started my career. This hospital as part of the community has been so for such a long time, for decades and decades. And that shows in the people who work here. So this is the entrance to our orthopedic clinical space. It's literally right next to the front entrance in the garage. So it's really easy for families to come in and navigate this. If you've got a broken leg, you've got a broken arm, the last thing you want is have to walk 15, 20 minutes to get to clinic. This is literally the first clinic right near the entryway. A huge space. We've got small tables for the kids. Usually have cartoons or some educational programming on the TV over there. And we have our check-in area right here. So once again, we try to make it a safe and friendly space for our kids and very convenient for them.
As the level 1 pediatric trauma center that covers all of Northern California. I mean, our catchment area goes to the mountains east of us, up to the Oregon border north of us, down south to the Central Valleys. You know, we really see and take care of everything. And as a renowned trauma center, people recognize that not just our orthopedic care, but the general surgery care, the neurosurgical care, the follow-up rehabilitation care really all ties in together. So we see pretty much any trauma that comes across, from the simple broken bone to the complex polytrauma. This is our Sports Medicine Center for young athletes, where we do a lot of physical therapy and rehab for our athletes who are coming back from various injuries. We have multiple different pieces of equipment here that we can use for athletes who are rehabbing. We've got our treadmills, we have our upper extremity strength machines. And over here you can see our sport court, great outside space. You can see that it's located right outside the Children's Hospital. People can be watching it from outside. Parents can be in the cafeteria or stepping up and seeing their athletes rehab. We've got a basketball court out here, but it's not just for basketball. People who are playing soccer, they need to do some bigger activity where they're running and cutting. So just a great facility and really helps our young athletes get back to playing sports, which is a big part of what we do here at Children's Oakland. One of the hearts of our practice is surgery with kids who come in with these various conditions. So the great thing here is that our operating room and pre-op area for our outpatient surgeries are right next to one another here, right on the 3rd floor. So literally a 1-minute elevator ride up from clinic, a really open space for families. Now this is the heart of our clinical operation. This is our orthopedic clinic where we have 8 clinic rooms where we can see patients with all orthopedic conditions. These are our clinic rooms here. We try to create a nice, safe, and welcoming environment for our patients and families. We need big enough spaces because we not only have the patients themselves, but the families who are coming and their siblings as well too. We also need a space where kids who may have wheelchairs or walkers can come in and really get the care that they need. A room has an x-ray machine here where sometimes kids can't go down to the physical x-ray machine, so we've got that here as well too. So we really try to make this a one-stop shop for kids and their families so they feel that they're getting the special care that they deserve. This is our orthopedic cast room where we have our cast technicians. We have individuals who are trained to put casts on, take casts off, pull pins, put braces on. We've got multiple different beds where casts can be put on, braces can be put on. So right down the hall from our cast room, we have 2 x-ray areas where kids can get their x-rays. And I think one of the key things is that when a kid comes with an injury, you don't want to have to go all over the hospital and get various things done. So we have our clinic right here. You walk 20 feet, you've got your cast room, and literally 10 feet from there, you've got our x-ray room.
The field of pediatric rehabilitation medicine itself is a newer field and still is a small field. So there's only a little bit above 350 board-certified pediatric physiatrists in the country. But at UCSF, we're really lucky to have 7 full-time pediatric physiatrists on faculty under orthopedic surgery, and 5 of us are mainly based here in Oakland. We have a inpatient rehabilitation unit, which is a 12-bed acute rehab unit. And we also have a robust outpatient rehabilitation program where we see patients in the physical medicine rehabilitation clinic as well as PT, OT, and speech.
Within the hospital, the pediatric rehabilitation inpatient floor is one of the few pediatric centers for rehab in the state even. And so we have wonderful opportunity for our complex orthopedic patients, be it a planned cerebral palsy multi-level surgery that benefits from rehabilitation in an inpatient capacity, or if it's our complex polytrauma patients that have gotten so debilitated either from their injuries or from their length of stay that an inpatient rehabilitation stay is a seamless transition for us.
Currently, we are at the UCSF Benioff Children's Hospital, Mission Bay campus, where our pediatric orthopedic clinic is at the 5th floor at Gateway Medical Building. We see a very broad range of pediatric musculoskeletal conditions, starting from childhood to young adulthood. We see common conditions such as trauma, so injuries that happen at the playground or at sporting events, to more complex conditions that require multi-specialty care. At the Pediatric Orthopedic Clinic, we have the radiology suite, which is part of our clinic facility. We have a cast and splint room for any procedures that our patients may need. We have MRI here at the Children's Hospital. We have child life specialists who can help with the process or the procedures as well. We're very well integrated with pediatric O&P for any off-the-shelf or custom bracing needs.
Today we are in the lab space at the Gateway Medical Building at Mission Bay Hospital. And this is the area where we make adjustments to the bracing. This location, we are seeing all of the orthopedic clinic patients that need to be seen, some very complex pediatric patients that are coordinating multiple appointments at this location, as well as all of the pediatric inpatients here at Mission Bay. Depending on what the device is and who's making it, we like to give the patient all of the colorful options so that they can really make something that is more fun to wear, that really customizes it for them, whatever their need may be. It makes it much more fun.
The pediatric physiatry or pediatric rehabilitation medicine service here at Benioff Children's Hospital is composed of an inpatient and an outpatient component. So we see patients who are admitted to our hospital, and we provide consultation services as well as provide inpatient acute rehab for children who are recovering from various changes in their function or have a new impairment or disability. And our outpatient service, where we see a whole host of medical diagnoses in children with conditions like cerebral palsy or spina bifida, through longitudinal care from birth till transitioning into adulthood.
Welcome to our Walnut Creek facility. This is one of our pediatric orthopedic facilities where we offer comprehensive care. We have our clinic, which is where we, multiple of us faculty will see patients. We have 8 clinic rooms here where we see patients. We try to keep them very family friendly. We have ample space in these waiting rooms to both look at the x-rays, wheelchairs, big families to come in, and it's very easy for our kids to access it with the nice wide hallways. And our staff up here are able to help facilitate appointments, get MRIs done, and really just help to troubleshoot all the problems that we're having. One of the great things about our clinic is how close everything is located. So our clinics rooms are just right around the corner, waiting rooms right there, and this is where our cast room is. So this is where all of our patients will get casted, they'll get braces put on. Whether you're injuring yourself, you have to go to our Oakland facility or out here. Same services, same cast techs, same way we put on casts and braces. Now, one of the great things as well too is that for kids, they sometimes will need x-rays, they'll need ultrasounds, and just right down the hall from our clinic area, kids can quickly and efficiently get x-rays and imaging down here. We have ultrasound, and then patients can flow right from the cast room over to our x-ray room. We've got our x-ray facility with the latest x-ray technology, nice big room so that wheelchairs and families can come in. We pride ourselves in making even the x-ray process really safe and comfortable for kids because it can be a very scary process. So keeping in the comprehensive nature of the Walnut Creek facility, we have 3 operating rooms here, 2 actual ORs and a procedure room. And orthopedics and plastic surgery are 2 of the biggest users of the operating rooms here. It's a full functioning OR. We'll do from babies all the way up to teenagers, even some young adults here with our pediatric anesthesia team, which is a really great facility that's set up for quick, efficient care in the ambulatory setting here out at Walnut Creek. We're here in our Sports Medicine Center for Young Athletes. You've seen our prior facility in Oakland as well too. This is our sister facility here in Walnut Creek. This is our largest sports medicine facility, and you can see here we have a huge open space for young athletes to get treatment for their injuries. We've got treadmills, we've got weight machines, just a lot of different apparatus and different equipment we can use to help our athletes rehab in a big open space where they can see other kids their age at the same time. We're currently in the motion lab right here, which is a big part of how we take care of our athletes as well as our regular patients who may not have athletic conditions. We look at injury prevention, we make sure that they're ready to go back to sport after their surgeries. And one of the services we're trying to expand on is also looking at our neuromuscular patients who need gait analysis done, who have conditions like cerebral palsy or spina bifida. With these cameras, we're really looking at motion 3-dimensionally. This camera captures all their data, and then we look to see in a quantifiable way, how are they doing? Where are things that we can work on so that they can get back to sport safely and improve their performance? So I think the most important thing for everyone to understand is that we have a large group of providers that work seamlessly across the base. You're going to get UCSF Pediatric Orthopaedics at all those sites. Whether you have clubfoot, you've got limb deformity, you've got a bad spine condition, we'll take care of you. If you need something like sports medicine or you need something more specialized, our providers are there. It's just going to be in a different scale than what you see over in the East Bay, but you're still getting that same UCSF Pediatric Orthopedic experience over there.